Hello everyone, this is the Health Hub Show and I'm your host Nyambura Kamau. So today I have an amazing guest and we are going to look at many great things, especially very useful to the women out there and any other female. But before that, I want to thank our sponsors for today, Yani DreamWorks Investment Limited Company, ambao they are the best company that produces and manages your property as you deserve. And what are we talking about? We are talking about architectural design, planning it, and not just that, but also interior design. I will give you more information, but before that, let's go back here. So, karibu sana.
Asante sana. Thank you for having me.
You're welcome. So,
yes.
Can you tell us your name and your profession? Wakujue vizuri.
My name is Jacinta Ramba. I am a clinical oncologist, or in other words, a healthcare practitioner who has specialized in cancer.
Oh, okay.
Yes.
So, well, thank you very much.
Asante sana.
And we are glad to have you here.
I'm glad to be here.
Okay, so leo tutakuwa tunaongelelea something to do with gynecological cancer. Is it said like that?
Yes, it's very important. Gynecological cancer, or cancers in women that affect their reproductive organs. Yes.
That is very common na tunapatanga sometimes tunaifichilia.
Yes.
Can you tell us what it contains? Ama shikanga wapi sana? Ama what is it about?
Okay, gynecological cancers are cancers that affect the reproductive health, the reproductive organs of females, which include the cervical cancer, the ovarian cancer, the endometrial cancer, and because breast cancer is also a very common cancer, especially in our setup here in Embu, we'll also touch on breast cancer.
Wow, I am so ready for this topic. Now, starting. Do they have common signs? Ama one particular sign yenye itakuguide through usikie kuna vile najisikia niko na cancer ama?
Unfortunately, cancer is a tricky thing because unlike other diseases like malaria, that you can clearly say that vile nasikia niko na malaria. So cancer comes with what we call stable signs that are hard to tell that this is really cancer. And most of them come with signs or symptoms that can present with other sicknesses. So the most important thing, what I tell women is know your body, and if you're getting treated for something and it is not recovering the way it's supposed to recover, or you feel that something is off, go for a checkup.
Go for a checkup.
Yes.
Now, speaking of a checkup, how many times should a woman be screened for cancer? Ama ni ukisikia tu fani ndo utaenda kuchekiwa?
Different cancers have different requirements of when and how you should test for them.
Okay.
But starting with the cervical cancer, it should be annual screening, and that is beginning 25 years, some say 30 years. But somewhere beginning 30 years, you should start your cervical cancer screening, which should stop at 65 years. If in the previous 3 years you had a screen and it was normal, so cervical cancer screening should stop at that. Breast cancer, on the other hand, should be annually until a certain point where now if there's nothing that is being seen abnormal in your breast, we can give 2 or 3 years for the checkup.
For the checkup.
Yes. As when we come to things like breast cancer, screening should be you yourself. You should be able to know how your breasts are, and especially after your period. So you should be doing it every month, so that if you find that something is abnormal, you go to a health facility for checkup. But it should be checked. You should have your mammograms every year, beginning the age of 45, 40. Yeah.
Oh, speaking of age 45 to 40,
Yes.
So who are at a higher risk of getting gynecological cancer?
The first risk is being a woman. When you're a woman,
you're automatically
at a more risk. Again, things like age. The more years you have, the more you've been exposed to these causative agents, and the more likely you are to develop cancer. Then the other thing is hormones. Hormones play a role, and especially in breast cancer, where if the first child you gave birth at a later age of over 30,
okay,
or if you did not breastfeed, or if you have not had a child at all, if you began your periods early, or if you reach menopause at a later stage, or if after menopause you take the hormonal supplement, all these are hormonal factors that can predispose to breast cancer.
Breast cancer.
Yes. The other thing is for the cervical cancer, actually 99% are caused by human papilloma virus. So infection to human papilloma virus predisposes one to get the cancer. And again, genetics. Okay. Genetics also play a role in if you've had first-degree relatives with, let's say, breast cancer, your chances of having breast cancer or probably ovarian cancer are higher than a person
whose family doesn't have such a history.
Yes. Again, lifestyle like smoking, heavy alcohol intake also is a risk. Diet, where you get high processed, a person likely taking high processed proteins, the animal proteins. A diet that is less in fruit and vegetables also it significantly increases the risk. Lifestyle, who we say sedentary lifestyle, a person who anaishi raha mstarehe, there's no exercises because exercises are preventive. And obesity and overweight also can predispose to some types of cancers.
Oh, okay. So how do you approach the treatment options available to the patient that has been diagnosed with gynecological cancer?
The treatment options. Okay, the major the treatment options for gynecological cancers, like just for any other cancers, are broadly classified into three. The surgery, where you aim to remove the part of the body that is infected with the cancer.
Okay.
And then the second one is radiotherapy, where radiotherapy is basically use of high energy X-rays to burn and destroy those cells. And then now chemotherapy. Yes, chemotherapy. There's the conventional chemotherapy that destroy the fast growing cells, because cancer is something unique with cancer cells. They are very fast multiplying, so the chemotherapy drugs target to destroy those fast developing cells. But now we have other newer agents like hormonal therapy. We have targeted therapy, which now these ones, the hormonal therapy, the targeted therapy, they are less immunotherapy also. They are more specific to the causative or the driving force of this cancer, as opposed to the traditional chemotherapy where they just destroy the fast developing cells.
Okay, when we are talking about these cells, they grow rapidly.
Yes.
Does this mean the cancer grows over time until now it starts to kuonekana physically, kuappear physically?
Yes. Cancer, probably we should have started with what cancer is. Cancer is when normal cells are not able to control how they divide and how they die. Because in normal circumstances, the cells are able to signal themselves through the genetic or the DNA. They are able to signal themselves to multiply or to divide. And when something is not right in the division, or when the cell is too old, they are able again to signal themselves to die. So now cancer now, when we talk about cancer, cancer is when now this ability to multiply and die is no longer there.
Okay.
So the cells now they multiply indefinitely.
Okay.
Yes, so the difference now between cancer cells and the normal cells is that they divide rapidly and they have the ability to move from the organ that it is affected to other organs, or what you call metastases. That is what it makes the cancer cell dangerous.
So it grows over time. Before you tell,
yes,
it'll take how long?
It depends with, there are those that we call poorly differentiated, and there are those that we call well differentiated. The well differentiated are very slow growing, while the poor differentiated, they grow very fast. So it depends with really what kind of cancer you have, and sometimes it can be well differentiated, but over time it mutates to be poorly differentiated, where it multiplies fast.
Now, the sensitive parts of women, ni penye imefika time, I want to give birth, maybe I want a child, this and that. So we really want to know how this cervical cancer ama any other cancer ya wanawake inaweza affect uzazi ama fertility. But before we get that answer, I am grateful that you're still here and listening to our show. I hope you're keeping up and I hope you're learning. It's time you understand your body and keep it safe, and not just safe. We need you healthy and fit. So we will be going for a short break. Usisonge, because we are here to learn and we are here to know more. Kabla tena tutoke, I will remind you again, don't invest in the wrong company. That is why we have DreamWorks Investment Limited Company. You have that beautiful house and you need interior design. They are the people you should give a call. Now, see you for the next episode.